Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight's topic is equine gastric issues and digestive health. This event is brought to you by our sponsor, Purina. An upset digestive system in horses can lead to much bigger problems, ranging from gastric ulcers to colitis to colic. To answer your questions, we're joined tonight by Dr. Alicia Long of the University of Pennsylvania's School of Veterinary Medicine's New Bolton Center. Dr. Long is a fellow in large animal emergency and critical care. She also has a research interest in equine microbiome and internal medicine. Thank you for joining us, Dr. Long.
Thanks so much, Michelle. It's great to be here.
So let's start out by having you tell us a little bit about your background with horses and then also your work and experience treating horses that have digestive and gastric issues.
Sure. Yeah. So I grew up with horses. My mother, we had horses at our farm, and so that was kind of what started me being interested in horses. And we had mostly draft horses and draft cross. And so I did, kind of various things with them as far as driving and pulling and everything like that, and some riding of them as well. And in veterinary school, I knew that I wanted to work with horses. That was kind of where my career path went that way. And I have just recently finished residency in internal medicine, and am now, as you said, doing my fellowship in emergency and critical care. And unfortunately for our horses, equine gastrointestinal diseases are really one of the most common emergencies that we see, hence colic. As well as, in my internal medicine residency, we certainly deal with a lot of chronic colic issues, gastric ulcers, chronic diarrhea, other things like that. So certainly have seen a number of cases of that. And then, as you said, my current research interests are mostly focusing on the microbiome, particularly the use of fecal microbial transplant. So that's currently where I'm trying to get some more information and see how we can use it to help horses. So.
Yeah, so the microbiome has become such an interesting topic in the last few years. How did it pique your interest? How did you end up doing that kind of work?
Yeah, so honestly, the first thing that started it was when I was doing one of my internships at Tufts University. We did a lot of fecal microbial transplant in horses with diarrhea, and this is something that has actually kind of been around for a while as far as giving healthy intestinal contents or healthy, feces to horses who are struggling with colic or diarrhea, particularly. It's really something that kind of is just done because some veterinarians have had success with it, and then it's kind of gets spread around as sort of this kind of anecdotal thing that works. But the kind of question has sort of always been, why does it work? And so that's something that really was kind of what drove my interest in trying to figure out why it works and how it works. And that kind of then just leads you directly to the microbiome, because that's really what we're doing is we're basically trying to take the gut bacteria and the microbiome from a healthy horse and give it to an unhealthy horse, and kind of give them a transplant of that material to try to encourage better GI health. And there certainly is a lot of things in the human literature, and it's expanding in veterinary literature too.
Yeah, and when I was going through the questions that our listeners submitted during registration, there were a lot of questions about diarrhea, fecal water syndrome, and just dealing with those chronic issues. I know I've managed a horse. He was wonderful, and we always said he had a poopsicle tail because it was,
Yeah.
I mean, it didn't matter what we did for him, tried and tried and tried. So hopefully we can talk about some solutions because that was, you know, 10, 15 years ago, and now I think we have more options. So before we jump into our questions, I want to give everyone a review of our Ask the Horse Live format. We're going to be starting with the questions that everyone submitted during registration. If you have a question that you'd like to ask live from our audience, or you'd like a clarification on one of Dr. Long's responses, you can enter it in the chat window in front of you if you joined us on your computer. We're going to do our best to get to as many of your questions as possible. If you're listening to our archive or podcast and you're interested in joining us live during one of our events, you can register to receive our announcements at thehorse.com or visit thehorse.com/askthehorselive. So with that, we're going to go ahead and get started. Our first question is from Lisa in South Carolina, and she wants to know what pre and probiotics you might recommend for horses to maintain a healthy microflora in their digestive tract. And part of that answer, I think that that we're looking for is what's the difference between a pro and prebiotic?
Yeah, exactly. So this is definitely a question that comes up a lot. And so a prebiotic is when you give, usually we think of like a nutritional or food product that supports growth and kind of development and reproduction of healthy bacteria. It can actually occur in any body system, but we specifically mostly talk about it in the intestines. And then a probiotic is when you're actually giving a bacteria to, a patient, a human, an animal, and trying to kind of give them almost a transplant of that bacteria. So those are the difference in those two. And there certainly, again, is, a lot of these type of things with the microbiome relating to probiotics and prebiotics is really we're learning more and more every day. But one of the things that we do know is, and one of the reasons that I actually really am a strong supporter of prebiotics over probiotics is that probiotics in horses, we really don't have a great understanding of what is the best singular bacteria to use to improve gut health. And there actually are some studies out there that show that, particularly in foals, but also in adults, that administration of probiotics can actually cause some harm. So in foals, probiotics actually have been linked to increased risk of diarrhea in both healthy and sick foals. And there actually have been also some kind of analysis of various kind of, over-the-counter probiotic products designed for horses that actually show that some of them can have some antibiotic resistance bacteria in them that isn't, known to be there until you analyze them. And so for me, I think that I want probiotics to be something that is going to be great for horses, but I think at this point we just don't quite know enough. And so when I'm talking to my clients, I really push them towards a prebiotic type product. And the specific prebiotics that has the most positive research in horses is called Saccharomyces boulardii. It's a human product as well. It's actually a yeast. And it has been shown in horses to alleviate the severity of salmonella and other types of diarrhea, and also decrease kind of shedding of salmonella. And so, it's something that isn't 100% and isn't going to cure a horse that has, acute, really severe diarrhea, colitis, but it is something that has some proven data behind it. And because there are human products available, and that's a lot of what we use for them, you can actually get kind of really pretty purified form of the Saccharomyces that contain what they're advertised to contain. So for me, that's kind of the main prebiotic that I go for horses.
And for in human articles, health articles that you see, there's the suggestion of having fiber and eating fiber as a prebiotic. Does the same go for our horses? Is forage helping the way
Yeah, exactly.
a supplement would?
Yeah, exactly. So yeah, so the kind of, obviously difference of horses versus humans even is that not only does fiber help them, but they really rely on, fiber and forage. And so certainly the feeding of forage is kind of at the simplest level, the kind of best prebiotic to help feed the bacteria. And so that is something that, is really important to consider. And I think luckily, kind of the trend is becoming towards people realizing that, sort of forage is important for horses. And that's why, I'm really excited about that seems to be something that we're all kind of as horse owners learning versus feeding really high concentrate grains and things like that, which are not as good for the normal and healthy gut bacteria.
So our next question is from Donna, and she sent it in via email, and she wants to know which is the best product on the market to remove sand and dirt from horses' colons. Do you have something that you recommend for horses that might need that?
Yeah, for sure. So psyllium is really the kind of gold standard product for removing sand and dirt from horses. There's been multiple studies that show that psyllium is kind of the most effective way. And there's a little bit of a difference as far as whether your horse has truly colic from sand and sort of a sand enteropathy, which involves where they get such a big buildup of sand that they can get impacted from it, or they can have a lot of inflammation in their intestines and again get colicky or diarrhea. And so those cases really require a veterinarian kind of intervention to give them large amounts of psyllium through a tube into their stomach. But the same psyllium can certainly be used as kind of a preventative measure to help try to clear out sand for horses that live on sand, dirt lots, horses that, maybe are in grass that gets really short during certain times of the year. Or anything else like that to try to prevent, some buildup of that. And, there's various different formulations of it, but psyllium is really, really the thing that has the best research for it.
And so many of us feed our horses a flax meal to supplement for omega-3s. Is that doing the same thing that psyllium does, or are you better off making sure that you're doing a psyllium treatment a couple times a year?
Yeah, if you really have, a concern for sand as far as, if your horse lives on sand or dirt, or if they've had an issue in the past and they went for colic and, that was the cause that was determined by the veterinarian, then certainly psyllium is really kind of the one that's going to be best. Omega 3s and things like that are really great for just overall kind of inflammation of the gut. But they're not necessarily as targeted at removing sand that is there. So again, certainly great products, but less about kind of removal of the sand.
We have a question from Mary in Arizona, and she wants to know, how would a horse get a salmonella infection? She said she had her soil tested and it was okay. Her mare survived, but it was a close call. Should she be worried that her horse could get it again from her property?
Yeah, yeah. I'm really glad to hear that her horse made it through, because salmonella can certainly be a really devastating disease and can have, unfortunately, a pretty high mortality, in horses. And so salmonella is a tricky one, because what we've learned is that salmonella is out there in horses and they carry it in their body. It's not so much that they have it their whole lives and, just kind of shed it all the time, but certain things can make them kind of hang on to it, get sort of infected with it in their GI tract, and then shed it to other animals. And usually the kind of source of salmonella disease in a horse would be either that another horse on the property that doesn't have any clinical signs is shedding salmonella in their feces, and then the horse that gets sick, for whatever reason, has a cause that makes them more susceptible to getting disease from it. Because plenty of horses can have salmonella and not have disease, but for instance, if a horse is stressed, or going through some sort of other illness, they can be more likely to actually get sick if they pick up salmonella from another horse. And again, it's through the feces on the ground, but again, it's definitely from that horse. And then the other thing that can happen is that horses can get sick from salmonella. It's in their own body already. Again, maybe they go through a stressful event, they have surgery for an orthopedic condition or something like that, go through a colic event, and they can start shedding salmonella. And oftentimes they don't get diarrhea just when they start kind of shedding it in their poop again, but they can get sick from it. So those are really the two main ways. And again, there's I'm not recommending that you go out and test every single horse that your horse has ever been in contact with salmonella for salmonella, because unfortunately it is shed periodically, intermittently, and so you can't always catch it when you test their feces. The time that we tend to catch it is when they're actually sick from it. And so that could be a little bit tricky, but the best thing to kill salmonella is sunlight and, kind of having open air, as well as trying to clean up fecal matter as much as possible.
Our next question is from Ophelia in New York, and she wants to know what you can do to prevent GI issues, specifically gastric ulcers, when giving horses NSAIDs. So can you touch on why that might cause gastric ulcers in horses, and then what we can do to help prevent those when our horses do need a little bit of bute to manage something else like osteoarthritis pain or an acute injury?
Yeah, for sure. So the way that NSAIDs work is, again, they decrease inflammation. And so what they do with that is they downregulate a lot of products in this inflammatory cascade that happens in our body, as far as, cells releasing a bunch of kind of inflammatory mediators. And some of that cascade actually is a little bit, helpful for other things. And so when the NSAIDs are decreasing that inflammatory cascade, they're also downregulating specifically prostaglandins, which are actually really good for vessel and mucosa health and blood flow to mucosa. And so that kind of decrease of that blood flow is what causes the issues that we see. And so the main things that we think of in horses, and certainly gastric ulcers can be from NSAIDs for sure, but we also worry about renal or kidney damage because of that, and also right dorsal colitis, which is often referred to kind of, in lay terms as hindgut ulcers, which again is specifically referring to a specific part of the large colon that is most sensitive to use of NSAIDs. So that's how they work that way. Go ahead.
Oh, sorry. Go ahead. Go ahead.
No, I was just gonna say, so as far as, preventing kind of GI issues from them, the best way to prevent them is to not give NSAIDs for long periods of time, which I know is what everyone is not trying to do, right? But I think, sometimes, especially if you struggle with a musculoskeletal issue, being cognizant of the fact that really those medications are meant to be given for, up to a week, maybe 2 weeks at a time, and should always be given under the direction of a veterinarian. And then the kind of other caveat being that certainly Gastrigard and things like that can help, prevent some cause of gastric ulcers, but actually Gastrigard is, omeprazole paste is something that works a little bit more for decreasing acid. And so it's not necessarily exactly kind of targeting the way that NSAIDs work. And so it certainly can be helpful, but honestly, the kind of main recommendation I have is making sure that they aren't on NSAIDs for too long, and that you use the, again, guidance of a veterinarian to try to come up with alternatives if they do need long-term pain control, and also trying to make sure that they're continuing to eat really well and drink a lot of water, because those both are ways that you can kind of help mitigate damage to the kidneys as well as to the intestines. So.
Okay. And there's a related question from Heather in Ontario, Canada, and she wants to know specifically about the long-term use of furocoxib. So that would be our Equiox that a lot of horses get as an alternative to bute. And it's thought to be not quite as hard on the horse's GI tract. Can those horses that are on that, especially long-term, have the same kind of ulcer and colitis issues that they might get from other NSAIDs?
Yeah, so the furocoxib medications, the Equiox, what they're working to do is, more selectively target one part of the pathway of inflammation versus kind of the whole pathway. And so they certainly are less likely to cause GI issues and renal issues, but there is some evidence that long-term use of furocoxib can especially cause elevation in blood markers that indicate kidney damage. And I have seen some horses that have had that present to the hospital. As far as the gastric, side effects, as far as ulcers or colitis, they seem to be less of a risk for that than the kidney damage. But certainly it is something that I think is possible, because they are sort of in the similar pathway. And so unfortunately right now we don't have studies on really long-term use, like years. And so I think that's something that, is certainly good to keep in mind if your horse is on it for a while, that you need to be monitoring blood work values, potentially if they have any issues that might be concerning, have a veterinary exam to try to see if those problems are arising.
We have some questions that have come in from a live audience. The first is from Jane, and she wants to know if she should be concerned about free fecal water in her horse. Her horse usually has it only for a few weeks in the fall, so it seems to be seasonal. Should that be concerning? Should she be addressing that, or should she let it take its course?
Yeah, it's a great question. So the thing of, sort of free fecal water is, and for those of you who haven't, kind of seen that condition, what happens is horses will often have kind of normal or slightly soft manure, and then around it or at the end of defecating, they will have, some liquid kind of that comes out. And so the time that does occur most is in the winter. And so that is certainly something that we see in horses, and I've seen that before. And I think most horses luckily are not bothered by it. So if it's occurring for a short period of time, they usually are, it's more of kind of a cleanliness issue for the managers versus, something that actually is going to affect their health. But certainly if it's something that, becomes more severe, your horse is not acting normally, or you just want to make sure that there isn't anything else going on, it's always appropriate to have a veterinarian, come out and take a look and make sure there isn't anything more sinister going on.
We have a question from Jen in our live audience, and she wants to know what the best treatment for foals with heat scours might be. Would it be a microbiome transplant that you've mentioned from the mare, or would prebiotics help?
Yeah, so interestingly, certainly actually one of the best things would be using kind of feces from the dam. And a lot of times, luckily, foals will eat their mother's manure on their own to coprophagia, which is certainly, not great to watch necessarily, but at the same time is actually a really good thing. And that is them basically giving themselves a fecal transplant. Some of the things that can happen is certainly if the foal is, starts out a little bit ill, or the mother is having issues, sometimes that doesn't work like it should. But certainly, as I said before, I would lean towards more so prebiotics, as well as just making sure that, they are staying kind of hydrated during that period of time. Luckily, most foals that go through that are not, clinically affected enough that they need anything more than just monitoring, and it's really self-limiting. And so again, luckily, even though it can be sort of frustrating and cosmetically, annoying, luckily most foals are usually pretty, they bounce back pretty quick. So And again, there is much less studies in foals as far as fecal microbial transplant in foals. And so that's something that I think we still need to elucidate a bit more, kind of, is that truly the best way to do it? But to me, physiologically, it makes sense that that would be something that would work. But again, the data is a bit more lacking in foals than adults.
So when in a foal is diarrhea an emergency concern that you need to talk to your vet? I mean, you could go, oh, it's they have diarrhea, the mare's in heat, this is normal, but there's that tipping point when the foal could become critical. What are the signs of that?
Yeah, exactly. So the things to really look out for is if the diarrhea doesn't resolve on its own with just a few days, or if the foal is at all not acting normally, right? So foals with foal heat diarrhea, yeah, maybe not quite as feisty as normal foals, but they usually still run around, play. They're still nursing very well. They're still doing all the normal foal behaviors. But if at any point the diarrhea progresses to worse, as far as it's really really frequent, really watery, the foal stops nursing, looks more quiet. You don't see the foal urinating frequently like it should. Foals usually kind of urinate every time they stand up, pretty much. And things like that are all signs that you should be more concerned. Also, foals with foal heat diarrhea don't often get fevers. They can, but they don't usually. And so certainly monitoring a foal's temperature during that period of time would be really important as well.
We have another question from our live audience. Dee Dee wants to know if you can comment on strategies for treatment of free fecal water syndrome.
Yeah, unfortunately, this is I wish that I had a magic bullet for all of you, but it actually is something that is still not very well understood. So what I will say is that the kind of sort of understanding of what horses it happens to and kind of when it occurs is usually geldings, older geldings, and usually during the winter. And especially I have a lot of owners report that when their horse, the grass starts to come back in. For instance, again, with us, when we here where I am, where we have really snow and everything, that in our area, that's when owners report that it kind of will improve. There has been a study, just one study, but a study that has looked at whether the microbiome of the fecal microbiome is different in horses with fecal water syndrome versus horses that don't have it. And it's definitely a well-designed study. And unfortunately, they didn't find any difference in the microbiome. And so, in my head, I always try to think of, okay, maybe fecal transplant would work. I'm certainly a big proponent of that, but the data seems to support that maybe that's not the reason it's happening. I think one of the things to consider is you certainly can try a prebiotic, even though, again, maybe the microbiome is not the issue. Something like Saccharomyces would certainly be something to help. And then honestly, actually, psyllium supplements, I think could be really helpful, because not only does psyllium help clear sand, but it actually provides really good nutritional products for the bacteria in the horse's gut, for the good bacteria. And so it can certainly be something that can actually kind of encourage, really good kind of gut health and help decrease inflammation as well. Again, we don't really have a great understanding of exactly why fecal water syndrome has, which makes it really super frustrating. So
we have a follow-up question from Jen in our audience, and it's about fecal transplant. She wants to know if a microbiome transplant could be the first step before assuming a horse has gastric ulcers and putting them on anti-ulcer medication. So should we jump to doing the microbiome transplant, or is there another path to diagnosis and treating before we get to that step?
yeah, so certainly I would say, the kind of way to do fecal microbial transplant is a veterinarian to do it, because, as easy as it would be if adult horses would eat feces, they tend not to, and so you do have to tube them with the transplant. And so what I would say is that, having a veterinarian assess your horse based on what clinical signs you're concerned of, kind of why you think maybe it'd be something that will benefit them, would be the first step. The gastric ulcers is something that, and we can talk a little bit later, if it kind of we get to there about, the symptoms of gastric ulcers. But if it's something that you are concerned about symptoms of gastric ulcers, then that is something that I would recommend trying to diagnose that before going to microbial transplant, because currently most of our understanding is that the microbial transplant is really helpful for the large intestine or the hind gut of the horse, because that's where most of the bacterial fermentation occurs. And so while there are bacteria in the stomach, it's not nearly as important of a mechanism for, kind of protecting the stomach and why horses may or may not get ulcers. So.
And our next question is from Claudia in Wisconsin, and it's specifically about gastric ulcers and what are the clinical signs of ulcers in a horse. And then also Karen in Scotland wants to know if horses' behavior will change dramatically if they have gastric ulcers.
Yeah, for sure. So gastric ulcers, definitely behavior change or reluctance to work or, kind of not perform their normal tasks is something that often will be kind of the first sign that owners pick up on for gastric ulcers. And that relates to the pain from the gastric ulcers, right? But the pain is usually not severe enough that, they kind of show it all the time. It's more, kind of activities that might make the pain of the gastric ulcers worse. And one of the things that we know is that there are two types of gastric ulcers, but the gastric ulcers that occur in the upper part of the horse's stomach, what we call the squamous epithelium, is related to acid splashing up on that part of the stomach because that part of the stomach doesn't have a good protection against acid because it's not supposed to have acid touching it. And so the way, unfortunately, that we manage our horses as far as, meal feedings versus constant access to food does, as well as exercise, can predispose them to that acid splashing up. And so that's why we often see that horses will have signs of, behavior change or maybe signs of pain or, discomfort or kind of being, irritated when they're ridden or when when their tack is being put on, other things like that. So those are kind of some of the classic sort of trigger things that we hear for gastric ulcers. The other one is that hay is actually less stimulating for acid production than grain. And so a lot of times clients will comment that horses will eat their hay totally fine, but will start to not want their grain, either not eat it at all or not finish it. And so that's another thing that might make you think more gastric ulcers. It is the rare adult horse that has colic from gastric ulcers. So, down, looking at their side, rolling, things like that. But it is possible. I've seen really bad gastric ulcers cause colic. Although again, it's not usually that severe.
Yeah, and I've had one of those, and it's frustrating and a little scary, because yeah. So
yeah, for sure, for sure.
yeah. And so Tamara in British Columbia, Canada wants to know if there's an amount of time a horse can go without feed before ulcers form. She wants to know how much feed should they have before they exercise. And so this is an interesting question because like my little mare who has gastric ulcer issues is a fairly easy keeper. And so she does so much better when I keep hay in front of her 24 hours a day, but then she blows up and it causes a whole nother set of problems. So where is the balance between feeding them 24 hours a day and keeping them in a good body condition?
Yeah, for sure. I find those are really some of the most frustrating, scenarios is you have a horse who can eat air and basically gain weight, but they also have gastric ulcers because those are definitely in some ways kind of competing issues to have. So there have been some studies that look at, kind of holding horses off feed and then scoping them repeatedly to look for gastric ulcers. And there isn't necessarily one magic time point, but it seems to be in kind of the 12 to 24-hour range is where some horses will start to show signs of gastric ulceration. And that doesn't mean that they have, really deep bleeding ulcers, but they can show some signs that maybe there is some irritation of the stomach occurring. And that's again with kind of complete fasting. So, in the kind of range of, horses not having food overnight for a period of, 6 hours, something like that is usually not something that in itself is going to cause gastric ulcers. And so, that is a good thing, right? Because it means that, you can hopefully feed your horse some hay and then kind of go to bed and then get up in the next morning to feed them more. And as far as easy keepers, again, certainly one of the things that can help is trying to find ways to make their, consumption of their hay slow down so that they're not, kind of eating it all at once. If they're especially are having to have less hay than maybe another horse their size because they do put on weight so easily.
Kristen in Washington wants to know if there's a feeding routine that you would recommend after a horse has gone through a round of GastroGuard and sucralfate treatment for gastric ulcers.
Yeah, so the kind of there are some horses that I will say have don't read the book as far as they might not kind of do what the majority is, but for the majority of horses, having constant access to forage is the best solution, and so that does involve pasture access. It's kind of the easiest way, right? If you have a pasture and they can go out and graze in it, that's kind of mimics their their natural feeding state the most. But certainly that isn't an option for all horses. And so then mimicking that with forage feeding, and try to give them to have as much forage as possible. And so, sometimes that just means you put hay in front of them as much as you can and throw it a few times a day. For other horses, if they can't have as much hay or they eat really quickly, we will recommend, some slow feeders such as hay bags with various size holes. There are all sorts of products out there. And I think for me, the main thing is whatever works for your feeding system, and also that your horse will tolerate, not destroy, trying to get into it, not, kind of hurt themselves trying to get the hay. And so it can sometimes be a little trial and error if you do have to go that route. There are a small number of cases that I have seen where, for whatever reason, being out on pasture is not actually lower stress for them or a better option, because sometimes, yes, they might have constant access to grazing, but maybe when they're out in pasture, they miss their buddies who aren't also out in pasture, or they're turned out with other horses that might be bullying them or something. And so I have had some horses that we make that recommendation and it doesn't actually seem to help their ulcers. So that really is kind of under the guidance of your veterinarian, and kind of repeat gastroscopy, scoping to look for ulcers and things like that to kind of see if they're one of those odd cases. But for most horses, they read the book. So
yeah, a lot of trial and error there. And like, I feel like I've tried every hay net and slow feeder on the market. I have a good collection of them. I could have a little
yeah,
museum of horse slow feeding options. But
yeah,
um,
exactly.
yeah. So we have a question from our live audience. Pam wants to know what your experience is treating a horse with inflammatory bowel disease. Is there any new research? So IBS, that's not something we hear a lot about in horses. Is that something that you're seeing research on?
Yeah, for sure. So we definitely have described in horses inflammatory bowel disease, so IBD, which is, a truly sort of, inflammatory, you could, sometimes use the term autoimmune condition, where basically, the horse's intestines are in a pro-inflammatory state, and that can cause them to have various issues such as colic, weight loss, diarrhea, things like that. And it is something that, certainly can be difficult to manage. And there are a few different types of IBD based on what type of inflammatory cells are involved. And so, the kind of there is some research for sure as far as kind of what the best way to manage them is. And I think in my hands it's a combination of management as well as medications. And I try to avoid the medications if possible, because most of the medications, the kind of what we often will sometimes have to go to is corticosteroids, which again have their own risk of side effects in horses. And certainly you would like to try to avoid giving them medications if you don't have to. Sometimes, depending on the type of inflammation, sometimes antihistamines will work. And then for other horses, something like a low bulk diet. So basically avoiding true long stem forage feeding. So either feeding a complete feed or hay pellets or chopped forage can sometimes seem to have a benefit as far as it's sort of less work on their intestines. But the kind of ideal would be is, if you have a horse who has, weight loss, recurrent colic, diarrhea, chronic diarrhea, as part of the veterinary exam, they can try to assess if they think IBD is what's occurring by using ultrasound or other things like that. And then biopsies are unfortunately the definitive way to diagnose it. And I say unfortunately because those can be not something that's usually done in the field. It's usually in the hospital setting. And so that is a little bit of a different diagnosis there. But yeah, there is some research that's out there that's trying to look more at kind of non-medication things. And I do think probably inflammatory bowel disease, or the slightly kind of less severe condition of IBS, or inflammatory bowel syndrome, which is maybe not as kind of much of an autoimmune condition, is probably underdiagnosed in horses.
And so is there a relationship between IBD and leaky gut syndrome? Because we do hear that talked about in horses, but and in cattle, I think there's quite a bit of research. But what do we know about it in horses, and is it related to IBD?
Yeah, I think this is where we start getting into the realm of we're still learning a lot as veterinarians and researchers as far as, how all those things interplay. But it is certainly would be naive to assume that the gastrointestinal tract has fully been figured out by us in the horse. And so I think that there is certainly likely a component of inflammation related to a lot of the conditions that we see, whether it truly is what we would characterize as inflammatory bowel disease, as far as severe enough inflammation, consistent enough inflammation inflammation, that is related to, the horse's genetics or whatever factors might be involved, which again, we still don't fully know in all cases, just like in humans sometimes that we don't have a great understanding. But I think it's likely that there is a component of inflammation in many conditions we see, including, leaky gut syndrome, hind gut ulcers, recurrent colic, things like that. But again, it's a little bit of something where I think that we are probably underdiagnosing in that inflammation. And whether it's truly something that could be diagnosed as true inflammatory bowel disease, or just that inflammation plays a role in a lot of the diseases we see.
We have a question from our live audience. Kay wants to know what your experience has been with acid rebound following gastric ulcer treatment with omeprazole. Do you have any recommendations for time course of treatment as they come off that drug?
Yeah, there was actually a recent study that did look at that. That is something that happens in horses, and it's something that I know is documented in humans as well. And so in horses, the current recommendation is to taper off, omeprazole products, Gastrigard, after a course of treatment. And so, for most horses, they will get, kind of a full body weight dose of omeprazole and Gastrigard. And then when you stop them, we often recommend doing kind of a half dose, for several days to a week, and then a quarter dose for several days to a week, and then stopping, because I think that's something that we have learned more recently in horses, and documented that does occur in horses. So it's definitely something that you don't want to stop that medication cold turkey if they've been getting a course of treatment for gastric ulcers.
Eileen in California wants to know how you can tell the difference between a horse having gas and a horse that's colicking.
Yeah, so colic, similar to, human babies and all that, really just means abdominal pain. And so, the kind of tricky thing about that is that there are many, many things that cause colic, and sometimes it doesn't even have to be related to the intestinal tract. It can, be anything else that's in the abdomen. So kidneys, liver, although certainly in horses, by far and away, the most common cause of abdominal pain is from the intestine. And so gas is a type of colic that we see in horses, where gas colic or spasmodic colic, which is luckily usually a relatively easily resolved problem. And some horses will either not need any treatment, might be uncomfortable, be rolling around, look really painful, and then without any intervention will just stop being uncomfortable. Or sometimes all they need is one dose of an NSAID, like flunixin, and then they are totally fine. What I will say is that if there is something where your horse is showing signs of colic, the really kind of the way to determine what is going on and how serious of a problem is to have a veterinarian out. Certainly many owners have flunixin at their farms and have it to use. And if your horse, if that's been prescribed to you by a veterinarian for that horse for certain instances, it's one thing. But, sometimes if you give a horse a dose of flunixin, they might look good while it's on board, but it's actually kind of masking something more sinister. So, gas colic is a type of colic that's usually short-lived, but it certainly can look similar to other really more serious conditions.
And we had a question from Debbie in Florida, and she was asking about lipomas, and those can cause colic as well. Can you explain to us what a lipoma is?
Yeah, so a lipoma is a benign fatty tumor. And the reason I say benign is because it doesn't spread throughout the body, so it doesn't metastasize, it's not malignant. But unfortunately, benign implies that it's not a big deal. And in horses, lipomas can actually be a really serious problem. And what happens is these tumors grow over a period of years, sometimes just a few years, sometimes most of the horse's life. And in some horses, they don't cause any problem. You would never know your horse had them. But in other horses, they can cause acute severe colic that requires surgery. And the reason that happens is that these tumors will grow, and as they grow on a stalk. So they almost are kind of like a ball on a string, and that ball can wrap around various parts of the intestine and block both food and ingesta from moving through the intestine, as well as block the blood supply to the intestine. And when that happens, it's again a serious emergency, and horses will be very, very painful from that. And it is something that almost always requires surgery to correct.
We have a question from Daisy in our live audience, and this is going back to gastric ulcers. She wants to know if you have any ulcer treatment or management recommendations for an insulin-resistant horse. So here you have a metabolic horse that might not be able to be eating hay 24 hours a day. What recommendations might you have for her?
Yeah, so the one overlap between gastric ulcers and metabolic disease that is helpful is that low starch or low sugars is actually beneficial for both of those conditions. So for insulin resistance as well as for gastric ulcers, because the sugars, the starches, such as you have in grains, certainly trigger more of ulcers than low starch things such as, forage and particularly, kind of low starch hays. And so one of the main thing is really to make sure that you are feeding a low starch hay, which you can have hay testing done, because unfortunately, while there are some kind of trends in different types of hay versus alfalfa, actually can have lower sugars and starches than some orchard grass hays. It can be very variable based on the load of hay, and kind of the time of year and all of that. And so luckily, most states have free testing of forage through their, state co-ops that you can kind of send in and get free testing, or if not free, at least very inexpensive. So that would be kind of the main thing, is that make sure that you're feeding low starch forage. And again, also avoiding feeding grains. And so what that would be is you can feed ration balancers, which basically are low calorie vitamin and mineral supplements. And that can help, give your horse that might have struggled with insulin resistance the vitamins and minerals they need that might not be in the hay, while also preventing, giving them too many calories. And then again, it does go back to kind of the slow feeding aspect, as far as, however you can try to find a way to spread out their meals so that they get consistent food as much as possible. Whether, again, that's a slow feeder. If your horse happens to live at your house, maybe you can feed them hay, multiple times. If you're lucky enough to work from home or work near home, again, that becomes tricky. But those are kind of the things that, you would be focusing on.
Yeah, I was going to say I work from home and I have for a long time now, and I feel like all I do is feed horses.
Yeah, yeah, you're your own slow feeder, basically.
Yeah. It makes them like you a lot when you bring them hay 4 times a day. So,
Yeah.
um, I have a question from Albert in Arizona. It's another colic question. Albert wants to know how quickly after an initial intervention for colic at home should you take a horse for a surgical evaluation. So where is that tipping point where you need to get them to the clinic, that they can't be on the farm anymore?
Yeah, so in my kind of sort of mind is that ideally I think it really is ideal to call a veterinarian out to evaluate every episode of colic, especially if it's the first time your horse is colic, so they don't have a history of it, so you kind of are, not sort of used to kind of what they tend to do. And then, the veterinarian on their exam might find some things that say, oh, we really have to go to the hospital. So again, for instance, things that, require that the horse is not able to eat. So they're refluxing, which is basically the horse equivalent of vomit. And so therefore they can't eat or drink water. And so they need continuous IV fluids, or their level of pain or what they're finding on their workup might be such that the veterinarian says, this is not something to even try to manage in the field. The kind of second scenario would be if maybe the workup is such that, they think it can be tried to manage in the field, or if you don't have a veterinarian out and you give a dose of Banamine. My recommendation is pretty much always that if a horse gets a dose of Banamine of flunixin, and, an NSAID, and it wears off and they're still uncomfortable, that is a time for me when I much more encourage people to bring a horse in for referral, because there might be something more sinister going on that needs, extra attention, or unfortunately even surgery. But the other caveat that I would have is, especially if you have flunixin on hand and, are giving it to your horse for colic, do not feed a horse after you give them flunixin for, at least 6 to 12 hours after giving that dose. And I know that sounds counterintuitive from an ulcer standpoint, but I have had horses that the flunixin makes them feel good enough that they will continue to eat despite having a serious problem, and that can actually make the problem much worse. So I always instruct owners that if they give a dose of flunixin, that they need to not feed the horse, definitely not hay, and if anything, only just kind of mashes and allow them to have water, versus letting them eat, because the horse doesn't know that they shouldn't eat if they feel better.
So if you go ahead and give that Banamine dose, how long should that last? And at what point, if your horse is still feeling better, do you know that, well, the Banamine worked and actually the horse is feeling better because we're past the efficacy of that drug?
Yeah, so the peak efficacy is for the first 12 hours after you give it. It does have some effect for up to 24 hours, but certainly if you give your horse a dose of Banamine and they become uncomfortable within 12 hours, that's a bad sign. And if after that 12-hour period the colic returns, then to me that would say that it's not working. So the kind of 12 hours are the critical period, but there can be some effect for up to 24 hours, but much less so.
And I'm going to give everyone a tip. My husband installed cameras in my barn, and I had a colic a couple of weeks ago, and having the cameras were huge because I could check on my mare from my phone and see her and kind of get some peace of mind and get some sleep, and then wake up and check her again, and I could see that she'd had some water because her water bucket was down. And I saw that she had pooped because I could see that from the camera. So if that's something that you can do and you have Wi-Fi in your barn, I just really highly recommend that. And it was only a few $100s to get a camera in there, and it definitely is worth it. So that's my sales pitch on cameras in the barn. So we have a question from Robert in Wisconsin, and he wants to know if certain breeds have been found to pass along a genetic predisposition to certain gastric ailments.
Sorry, I was just taking a drink of water. So there are a few breed predispositions that we know of, and the kind of biggest one being Friesians, who are obviously very beautiful, but unfortunately do struggle from some certain types of colic. The main one being gastric or stomach impactions, where their stomach doesn't empty as it should, and so food can build up. And that can be something that can be a pretty serious deal. Luckily, doesn't require surgery to fix, but unfortunately can recur. And then standardbreds are actually predisposed or have a higher incidence of inflammatory bowel disease. And so they are some that, might be more likely to have kind of recurrent colic that way. A lot of the other breeds, it's kind of a little bit more related to their management of why certain breeds might be more likely to have certain types of colic. So for instance, thoroughbreds, obviously there's a large operation of thoroughbred breeding in certain areas of the country. And so those mares might be more likely to have a large colon volvulus, or basically a twist of their colon. But again, whether that's really related to the fact that they are thoroughbreds is probably less likely than just kind of the fact that we see a higher incidence of that type of colic in pregnant mares or mares who just foaled.
So with the management piece, I know people have recreational horses, and they'll be like, oh, my horse has no stress in their life. There's no way they have gastric ulcers. Is it possible for horses that aren't showing in performance programs to get gastric ulcers and be suffering, and maybe their owners aren't noticing it?
Yeah, for sure. I mean, we certainly do see a much higher incidence in horses who are competing because of, like I talked about, the fact that, they probably do have more stress, and also they have, kind of more splashing of acid up into their stomach from the frequent riding, and also maybe are managed more with more infrequent meals. But I have certainly seen ulcers in horses that are just pasture pets, that kind of sit around and do nothing. And, I think some of the things to remember is, like we talked about, long-term NSAID use, or maybe they're retired because they have an orthopedic issue, and so maybe that predisposes them to what we call glandular ulcers, or ulcers that are in the bottom of the stomach, which are most susceptible to NSAID things. Or it could just be, unfortunately, something that maybe we haven't figured out why it happens, but they are predisposed to ulcers. And I have some horses that I don't have a great reason for why. They seem to have the least stress-free life, but they do get recurrent gastric ulcers. And in that case, it is a lot of management of unfortunately, somewhat of trial and error of trying to figure out what works best for your horse, and kind of to keep them from getting recurrence of ulcers, whether it's, how you feed them, or where they're kept on your farm, whether they like to be in a stall or not in a stall, or things like that. So I often find that those horses, it's more so kind of a little bit of a detective work to try to figure out why they're having ulcers than the horses that are in active training and competing.
We have a question from Cindy in New Jersey, and she said weaning can be a really stressful time for foals. Should weanlings be given ulcer guard, or is there an alternative to help them during that transition?
Yeah, so I, am always a little bit hesitant to use omeprazole products as a prevention for ulcers, because of the fact that it can, again, has been linked more so in foals than weanlings, so younger age, but has been linked to, increased risk of diarrhea, like I talked about. as well as, there is a reason that horses have acid in their stomach, right? It does serve a purpose. And so for me, it's more so trying to, kind of ensure that you have, it can be easy if you have multiple weanlings. It's certainly helpful for them to be weaned together. That can be kind of reducing the stress. And then also a medication called sucralfate, which is actually kind of coats ulcers, can also be something helpful as a preventative. And I tend to reach for that as more of a prevention, especially in foals or weanlings, because it can coat and kind of heal any areas that might be starting to get eroded or irritated, but is not going to affect the acid production at all, and so shouldn't interfere with kind of normal digestion. And so that's something that, is a prescription medication from your veterinarian. So you could certainly kind of talk about that, in conjunction with your veterinarian.
And I think we have some research on thehorse.com, and maybe our producer Jennifer can look for it and pop it into the chat, about some less stressful ways to wean. So the transition away from the mom and the diet is hard, but there are ways to do that in a more progressive way that's maybe not as dramatic as we've done in the past. I know when I was younger and weaned horses, it was always pretty traumatic, even just as a human being around it. It can be pretty stressful.
Yeah, exactly.
And so we'll see if Jennifer finds that article and pops that in, to help Cindy out. We have a question from Alex in our live audience. She says she has a thoroughbred sport horse that travels to show frequently. She says it's a demographic that she knows is prone to gastric ulcers. Should she get him on a daily probiotic or a different kind of gut supplement to give him support?
Yeah, so certainly I think that, there is different research as far as various things that can try to help prevent gastric ulcer formation. And a lot of them are kind of, single ingredients or looking at kind of combination products that, are looking to try to prevent ulcers. So if your horse has not been diagnosed with ulcers already, then, some of those things that you could consider again are something like even, some of the psyllium, some of the Saccharomyces. Again, they're not as targeted at the stomach, but you could consider those. Some of the other things that we know are some of those, again, just kind of anti-inflammatory things, so some omega-3s. But actually, one of the kind of things that I really like the most is trying to, quote unquote, buffer the stomach acid. And I find the best way to do that is, if your horse is able to eat alfalfa, to use some sort of small feeding of alfalfa hay once a day before rides particularly, or something like alfalfa cubes, hay cubes, because that kind of has a natural buffering effect from the calcium that's in the alfalfa. And luckily you can kind of do small feedings of that, so it doesn't have to be all that the horse eats. And so, you can kind of use that to manage so that they don't, just get alfalfa, and you can kind of work it into their normal diet.
Jennifer, our producer, found that article. You can go to thehorse.com/17528, and it's about research-based weaning tips to reduce stress. So if anyone has babies coming this spring, you check that article out. It was pretty interesting. Janet in Nampa, Idaho wants to know how likely it is for a horse to colic if they've already colicked in the past.
Yeah, this question a little bit depends on what type of colic the horse had. So there are certainly certain types of colic that we know that are more likely horses will have recurrent episodes. So again, certain types where the colon might get gas ascended and move out of place, or again, twist like I talked about before. But there are other ones that we luckily often see them kind of just one and done. Like for instance, if your horse has surgery to remove a lipoma that has caused an issue, luckily that, that recurrence of issue is unlikely to happen again because, you've removed kind of the offending source. And so I think also, though, there is a large amount of work that needs to be done looking at recurrent colic in horses and chronic colic, because we do certainly have some horses that will have vague episodes of recurrent colic and we don't know why. And the episodes might be similar as far as how they present, and, sort of trying various things doesn't necessarily always stop it. And so there certainly is, a risk, but it a little bit depends on the type of colic that your horse has had.
We have a question from Terry in Florida who wants to know what the first signs of colitis might be.
Yeah, so colitis, or what we often talk about is kind of acute diarrhea. One of the tricky things in horses is that diarrhea in colitis is not actually always the first sign, or sometimes doesn't even become one of the major signs. And so one of the first things that owners will often notice is a horse might be less interested in eating, or might be acting quiet or not quite themselves. And oftentimes that's actually because they have a fever. And so I always recommend that owners have thermometers at home. Certainly mercury thermometers are fine, but you can get those digital thermometers that you just buy at the pharmacy, and those work well too. Because if your horse is not acting quite right, not really wanting to eat, taking a temperature could be a really helpful way to know, kind of what might be going on, and will also be super helpful for your veterinarian to know if you're giving them a call. So again, kind of quiet, not wanting to eat could be one of the first signs. Lying down more, things like that, having a fever, those are often kind of the first thing you'll see. And certainly, you might also see diarrhea, and it might kind of start as their feces just looks more soft than normal and kind of progresses to diarrhea. But again, usually for me, the first thing that clients will say is, oh, my horse wasn't really acting right, was kind of quiet, not really wanting to eat, maybe lying down more than normal. And that is kind of one of the things that tip you off.
We have a question from our live audience. Katrin wants to know if bots can cause horses to have ulcers in their stomach, and what's the best approach to dealing with them.
Yeah, so bots luckily are something that tend to not cause horses too many issues. Certainly where they attach in the stomach can cause some damage to that stomach. But again, most of the time when we have bots in horses' stomachs, they're usually incidental findings. Whereas, we might be scoping them for a reason that's not causing pain and we see the bots, or if we're doing a gastroscopy to look at the stomach and we find other ulcers, and when we heal those, even if the bots are still there, it's not really the problem. But the way to deal with bots is they're very sensitive to ivermectin dewormers. And so one of the things that we are seeing is that now, as we are trying to be better about not over deworming our horses, is that sometimes we see bots more frequently because we are giving them less, or maybe not at all giving them ivermectin dewormers. And so, working with your veterinarian to come up with a deworming plan, but using an ivermectin product or avermectin product once a year is usually enough to control the bots. Also, the bot eggs will live on horses' legs. They're little yellow, small, kind of round eggs that stick a lot to the horse's legs and their side. And then when the horses nuzzle or lick and then swallow those eggs, that's how they get in the stomach. So if you see that your horses has those eggs on their legs, you can also work to kind of remove those before the horse can swallow them.
And then, that's something that we haven't talked about tonight, and we only have about 4 minutes left, so I don't know how much we can cover on it. But internal parasites, what kind of effect can that have on the horse's digestive system, and should owners be worried about that damage?
Yeah, so what we're learning is that, internal parasites are kind of a normal part of horses' lives. And so it's probably, the goal for horses is not to have them have no parasites. It's really to have them not have too many parasites. Versus, when you're talking about dogs, you don't want your dog to have any parasites because they live in your house and you don't want to be around their worms, right? So it's a little bit different of a goal. But one of the main things that we see with parasites in horses is either no signs if they have a low enough burden, which is good. You can sometimes see colic. Particularly if, as the worms are going through different parts of their life cycle, they might be more likely to cause inflammation in the gut and therefore discomfort. Or you can see diarrhea. Usually it's more of like a chronic diarrhea, but again, when the worms are going through different parts of their life cycle, sometimes they will have kind of an acute, exacerbation and get acute diarrhea and can be severe. But certainly kind of like, any horse that sort of, has trouble putting weight on, has an ill thrifty coat, a poor hair coat, might be something to kind of investigate the worms, the internal parasites.
We have a question from Lisa in our live audience, and she wants to know if there are any updates on rotavirus, and she said particularly variant B in horses.
Yeah, so rotavirus is something that we used to kind of consider could cause a lot of diarrhea in foals, but actually was relatively self-limiting. But in Kentucky, they have definitely had this outbreak of this new strain, which can be really severe and cause a lot of disease. And so I know that there's a lot of work being done in Kentucky to try to figure out how we can prevent that that from occurring, and working on various vaccinations for that specific strain and things like that. And so a lot of that research is still ongoing. And so unfortunately it is still a big problem, especially in large groups of mares and foals that are being commingled. So that is definitely a developing area right now.
We have a question from Jen in our live audience, and she wants to know if diatomaceous earth can help with sand ingestion and colic.
Yeah, so diatomaceous earth, most of the time when I'm hearing people kind of, ask about that, it's related to deworming. And what I can say is that it is not effective against internal parasites in a way that is really as useful as dewormers. And so more so an effective deworming strategy is better for that. As far as sand and colic, I think there is some evidence that maybe it helps a little bit with inflammation and things like that, but unfortunately there's a lack of kind of true data that says it's definitely effective. It's probably one of those things that isn't going to hurt and may help, but I always hesitate to use that phrase because, again, we used to say that about probiotics, and I think we're learning that maybe that's not true. So I would kind of have that, as a caveat to other things too, that maybe there is kind of, we don't know fully the effect they're having. But yeah, I myself haven't used diatomaceous earth a ton for kind of addressing colic and things like that, but there is some things to suggest that maybe it would help.
Okay. Well, unfortunately, we are out of time. We did some rapid fire there in the last 10 minutes. So thank you, Dr. Long, for helping get to all of those questions. I want to thank you for joining us and answering. We covered a lot of ground tonight. And so thank you for being willing to ride along with us and answer the variety of questions that we had. We appreciate it.
You're so very welcome. It's my pleasure. Thanks for having me.
I also want to thank our sponsor, Purina, for bringing this event to our audience free. To everyone who's listening, thank you for being here during our live event, and for those in the future for listening to the podcast. We hope that you can join us next time live. Until then, from all of us at The Horse, have a great night.